Welcome, and thank you for taking the time to watch this demonstration on meaningful use, how to achieve the core and menu measures. This demonstration will cover core measure number 1. Let's get started. Core measure number 1 is to use CPOE for medication orders. Let's open up the PDF from the MTBC website and take a look at what exactly this means. Core measure number 1 out of 15 is to use computerized provider order entry for medication orders directly entered by any licensed healthcare professional who can enter orders into the medical record. The measure here is more than 30% of all unique patients with at least one medication in their medication list seen by the eligible professional have at least one medication order entered using CPOE. In layman's terms, what this means is that you must enter at least one medication electronically into a certified EHR during your reporting period. And there is an exclusion for this. The exclusion would be any eligible professional who writes fewer than 100 prescriptions during the EHR reporting period. And for most MDs and DOs, even nurse practitioners and physician assistants, you'll generally be writing more than 100 prescriptions over the course of 90 days. However, if you do not write 100 prescriptions over the course of your 90-day reporting period, then you're excluded from this measure, and it's not required for you to achieve this measure. In fact, the exclusion applies as successfully passing, and you'll be reporting how many prescriptions you sent electronically. So if we look, before we jump into the details of the EMR, I think it's important to understand the definition of the terms. So computerized provider order entry just means electronically entering the medication into the EHR directly or into your mobile device. So with MTBC, you have three options of places to enter medications. You can enter medications directly into the EHR, or you can enter medications into the MTBC website, and those medications will sync up with the EHR. Or you can enter medications into your iPhone or iPad, and those medications will also sync up to the web and to the EHR. So if we remember the measure, it's 30% of unique patients. So and here the definition of the term unique patient is if a patient is seen by the eligible professional more than once during the EHR reporting period, then for purposes of measurement, that patient is only counted once. And you'll see this concept of unique patient in many of the other meaningful use measures. Now, when it comes time to report to Medicare what you've completed, there are attestation requirements. So there are three factors and three items that you'll need to report on. The denominator, total number of unique patients with at least one medication. The numerator, the number of patients in the denominator that have at least one medication entered using the computerized provider order entry or just entered electronically. And of course the exclusion. Any provider, any eligible professional who writes fewer than 100, you must enter the number of prescriptions written during the EHR reporting period into the exclusion box to let them know that you're being excluded from this measure. So again, denominator, the number of unique patients with at least one medication, and the numerator, the number of patients within that denominator that have at least one medication entered electronically. So those are the differences. And these PDFs, by the way, directly from the MTBC website, you can pull them up any time that you like. There are some bits of additional information that you may want to look at that are available in this PDF. The provider is permitted but not required to limit the measure to the patients who are only in the EHR. So if you're a practice that's in transition, you're in the process of adopting the EMR, this doesn't necessarily apply to all of your patients, but only those patients that you have now begun documenting in the EHR. And for this specific requirement, for this first measure, This measure is specifically dealing with electronic order entry. It's not dealing with submission to the pharmacy. It just means document it electronically, put it into the software electronically. And now the next part of this demonstration is to go into the details. How do we do that from the MTBC EMR? So now let's transition over to the MTBC EMR and let's take a look at how we meet this requirement directly through the MTBC EMR. If you're an MTBC client, you can open up the EMR on your own system and follow along during the course of this demonstration. So now we're in the MTBC EMR, and we're going to begin documenting a medication using CPOE in order to meet the meaningful use core measure number 1. Okay, so if you remember what that measure is, it is to enter medications electronically into the EMR. So let's go ahead and find a patient, open up that patient's record, and enter at least one medication for that patient. So here we are on the patient list. I can search for any patients of my choice using the last name or first name or date of birth or any other criteria. So I'm just going to go ahead and find Esther Johnson, and here she is. I'll open up her account. I'll go now to the charts section because, as we know, the chart section is the clinical documentation portion of the EMR. So we'll go ahead and click into the charts tab. And here we can see all of the previous dates of service where this patient has presented at our office. And I'll go ahead and create a new date of service for today's visit. Once I'm in the chart for today's visit, I can go directly to the medication section by clicking on the plan of care. And here I can review all the current medications that this patient is on. If I want to prescribe a new medication, in order to meet this requirement for meaningful use, I can just go ahead and click into the medication section by clicking here. The first thing that will happen is that the RX Hub benefit plan information will display. If there is no formulary benefit plan for this patient, the system will let us know, and we can go ahead and say use none. And now we can begin documenting a medication electronically. Now, for the purposes of this meaningful use measure, it's not required that we actually submit this prescription to the pharmacy. It's simply that we should document this medication on the patient's record. And to do that, we have an option at the top of the medication window to choose the type of medication that we're going to document. So here, I'm just going to choose the option for prescription to show that this is just a medication that the patient is currently already taking. So go ahead and click into the medicine section, and I can begin typing. Once I type out a medication, I get my results. I can double click on the medicine of my choice, and a SIG will automatically populate. I can also add a quantity or a day supply or refills if I like. The system will also tell me if there are any drug-to-drug or drug-to-disease warnings, and this is an important part of one of the other core measures. But for now, we're just going to change our medication. And once I've selected my medication and I'm happy with that medication selection, I can click OK and save that medication on this patient's record. And there we are. That medication is now saved on this patient's record. And let's do that for another patient. And let's even say a new patient that we create, just to show you how easy it is to document a medication on a patient's record. I'll go ahead and put in some demographic information. Now I'll go to her charts section. I'll create a new chart for today's visit. I'll go right to the plan of care. I will click into the medication section, use none, and now I will change the type of medication to a normal prescription, so I'm not sending this electronically. I'll select my medication, and I will click OK. So now I have successfully documented a medication for a unique patient. I've entered it through CPOE, or computerized provider order entry, and I've saved my entry. So now I have successfully met core measure number 1 for these two patients. And that is how we meet core measure number 1, use computerized provider order entry for medication orders directly through the EMR. And remember, you have to do this for more than 30% of your unique patients. So if you look at the course of your normal workday and your normal patient load, every patient, if you were to document one medication, you would meet this measure in flying colors. If you are staggering your implementation or adoption of the EMR, then perhaps every other patient, or pick one day out of the week and do computerized provider order entry for all of those patients. There are many different ways that you can meet this requirement, but for 30% of all of your unique patients who are stored in the EMR, you should have at least one medication entered electronically into the system.